Hello. Last week in class, we were discussing social justice as it relates to health disparities and health inequities. During our discussion, the issue of how these topics relate to deaf people was raised. The class brainstormed the possible barriers that deaf people experience which contribute to this problem. We noted 4 issues. First, there's very little data collected regarding the health of deaf people. Second, communication access to health information and health care is a significant barrier for deaf people to contend with. Third, many deaf people have low health literacy, in part as a function of limited reading abilities that make medical terminology difficult to comprehend. Fourth, there are biological factors, genetic or otherwise, that may cause hearing loss as well as other health inequities. After that discussion, I asked each student to come up with 2 recommendations to address these barriers for their homework. Today, the students will return to class and we'll discuss some of the very good ideas they came up with. Hey, good morning.
Good morning.
Good morning.
I read your papers. I was really impressed. You offered so many good ideas about how to reduce health disparity risks among deaf sign language users. I chose 6 of your recommendations. For us to talk about today. Nick, you were one of several people who suggested this first idea. Can you explain more to us about that?
Okay. All health information on websites, podcasts, television, even health information that hearing people get from the radio should have captions or a way for deaf people to get transcripts.
Sure, that'd be a big help. Now, your paper also said that health information designed for children should have captions or transcripts. What was your thinking there?
Not just for deaf children, but for hearing children whose parents are deaf. That would help deaf parents make better decisions about their children's health as well as their own.
No, not just that. I think that information should be available in American Sign Language. That would be a lot better for many deaf people than English captions or transcripts.
Martina?
But translating English into ASL isn't easy. Many medical terms don't translate well into ASL. I wouldn't trust many public health experts to know how to make really effective sign language films for deaf audiences.
Yeah. Tiffany had something about that problem in her paper. Would you like to explain a little bit more about that?
I had said that public health people should collaborate with the deaf community to make health information appropriate for a variety of deaf people. Deaf people should be involved early during the planning and the creation of these materials so that the outcome fits our needs. Oh, and also I said that deaf people should be involved in how disaster information and emergency communication plans are made in different communities or states. It's very hard for deaf people to get information during emergencies like tornadoes and floods, especially when the electricity is out.
Right. And disasters like that are part of public health's responsibility. Let's talk about number 2, including deaf people in research. All of you suggested that. Martina, I like what you said about this. Would you please explain what you wrote to the class?
Well, we already have many health surveys and research that's already going on. We just need to include deaf people and make sure they can answer surveys and participate in research accurately.
And how do you suggest that happen? Exactly.
Well, the survey should be offered in ASL.
Sure. That technology is improving. But what about telephone surveys?
Well, like Tiffany said, researchers should collaborate with deaf people to figure out how to solve that problem.
Julia?
I don't know. Even if there were surveys in American Sign Language, I think many deaf people wouldn't trust hearing researchers and wouldn't want to get involved. Besides, deaf people aren't used to being a part of research studies the way hearing people have been. Research would be a very new thing for many deaf people. It might be scary to them and make it hard to recruit deaf people to get involved.
Great point. What could be done about that? Nikki?
The way scientists recruit deaf people must match our community and our deaf culture.
Yes?
The best way to do that is for scientists to work with the deaf community as partners in research. The data and results would be so much better.
That idea is called community-based participatory research. The abbreviation is CBPR. That's good. That relates to idea 3. Whose idea was this?
That was my recommendation. Including deaf people in health research is great, but only if the information collected will really help improve knowledge about deaf people's health.
Can you explain a bit more, please?
For example, if a survey just asks, "Are you deaf?" like a yes or no question, then we won't know if someone was born deaf or an adult who recently lost their hearing.
Yes.
Think about someone who grew up deaf compared to a person who lost their hearing at age 60. Their health knowledge and experiences are totally different.
Wow, that's a really good point. I think researchers should ask more questions about the person's background.
Yes. We call those demographic questions.
Yeah, like, do you use sign language? What kind of sign language? Did you go to a deaf school or mainstream school? Did you have deaf parents? Things like that.
Yeah, I understand. All those different experiences could influence health literacy, access to health care, and other things related to health disparities. Wow, that's really complicated.
It sure is. How do we help scientists come up with the right kinds of questions?
What you said, CBPR, involving deaf people in research.
I suspect most scientists are really uneducated about sign language, growing up deaf, deaf culture, and the deaf community, making it very difficult for them to interpret their data accurately. Maybe the results they think are true are really wrong and don't fit our community and culture.
Well, that leads to idea number 4. How do we get more deaf people involved in public health activities like research? So we can help scientists and other public health workers do a better job.
We deaf people should do public health research ourselves.
Naturally. Yeah. Many people like you are getting the education they need to be the future generation of scientists or doctors or politicians or other kinds of professionals who can bring us the information we need to reduce deaf health disparities. That's another point many of you raised in your papers. Now, this 5th point. What are some other ways deaf people can get involved in public health? Remember, not all deaf people go to college like you. Tiffany?
Well, back to CBPR. Public health professionals should reach out to their local deaf community. Every city in America has one, whether it's big or small. It isn't that hard to find a way to get in contact with deaf people. Any hearing person could do it if they tried.
Instead of waiting for researchers to come to us, we could go to them. Deaf people could go to conferences about public health and talk about these issues. I'm from Atlanta, Georgia, and I know there are big public health conferences there often.
That is a great idea. But those conferences would need to plan for interpreting services, captioning, and other accommodations. If not, deaf people won't go.
Right, but equal access is required by the Americans with Disabilities Act.
True, if conference organizers knew how to make those communication access plans. Many don't. That's why they need to hear from deaf people like us who want to participate in those conferences. Let's move on to recommendation number 5. Jason, you mentioned earlier that more deaf people should pursue public health careers. Can you explain more about that for us?
The fastest way to make public health research or healthcare services better for deaf people is to become leaders in these fields ourselves.
Yes?
I've seen advertisements that promote health careers for minorities. There are scholarships and other special programs to encourage minorities to pursue careers in healthcare research or get involved in practicing medicine.
But do those opportunities include deaf people? Many people don't understand that deaf people are a linguistic and cultural minority.
You're right. Some of those career development opportunities are for racial and ethnic minorities. And deaf people often are not included.
Oh, that's not fair. Social justice and health disparities apply to us too.
You're right. So, we have to educate hearing people why the signing deaf community is the same as a language and cultural minority group.
I read an interesting article. It talked about how young deaf people who are studying to become healthcare professionals often have interpreters in the classroom, but still don't have access to the informal curriculum.
Right. Can you explain to the rest of the class what informal curriculum means?
Well, it means all the learning that happens when you're not in a classroom or formal teaching situation. For example, discussions between students when no teacher is around, or casual discussions with teachers after class, or with mentors, or even social gatherings where people talk about work.
Yes. At the professional education level, a lot of learning happens through the informal curriculum. Equal access for deaf students to the informal curriculum at that level, it's a special challenge. But new ideas, like designated interpreters, are becoming more popular for deaf persons in professional training programs. Nick?
I know there aren't many, but they are out there. There are some signing deaf people who are doctors, nurses, researchers, and public health workers. I've read articles and books written by several of them.
Mm-hmm.
Medical schools, graduate schools, and other programs should contact these deaf professionals and the schools where they trained.
Mm-hmm.
These deaf professionals are pioneers. They could help other schools understand how to teach and mentor deaf students successfully.
You all have really thought through these various issues. More deaf professionals and deaf researchers would really help collaboration with public health workers. That'd improve things for everyone. Let's look at this sixth recommendation. Funding to support communication access. Julia, you said something important about that.
Well, the idea is simple, but very important. Interpreter services are essential for communication between deaf sign language users and healthcare providers. Without more access to interpreters, it will be impossible to reduce deaf health disparities. Training more deaf doctors and nurses is a great idea, but that won't happen fast enough to reduce the health disparity deaf people experience throughout America.
My comment is about interpreters and research. I went to a conference and talked to a person doing deaf health research. He complained that he has to pay for interpreter services from his research grant budget. He felt that that cost wasn't fair. Researchers who are studying the same health problems with hearing people don't need to pay for interpreter services. That made sense to me. He thought the grant agencies should give him extra money for the interpreter costs. He called it a supplement, which is not charged as regular grant budget for interpreters. I thought that was an interesting point of view. It really isn't fair compared to hearing research budgets. Hearing researchers can spend all their grant money investigating the health problem, but he has to spend a lot of his grant money paying for interpreters.
Oh, there's another example of a deaf health disparity right there.
This has been a great discussion, but we're out of time. So, who's going into public health work in the future? Jason?
Wow, I feel inspired. I want to get involved in public health research.
I'm applying to medical school.
Well, good luck, Doctor.